All right, so bones of the pelvic girdle and lower limb. The pelvis and bones of the pelvic girdle and lower limbs complete the appendicular skeleton. The hip bones or coxal bones, also known as the os coxae, make up the pelvic girdle. They articulate with the sacrum, which is a component of the axial skeleton. The pelvis is a somewhat bowl-shaped structure made up of the sacrum and the two coxal bones. It creates the boundaries for the pelvic cavity. There is the pelvic inlet, which is the oval opening formed by the sacrum and the pelvic girdle. The pelvic brim, which is a bony ridge surrounding the inlet, defines the boundaries between the greater and lesser pelvis. The greater or false pelvis is the area superior to the pelvic brim. The lesser or true pelvis is inferior to the brim. The pelvic outlet is the opening at the inferior boundary of the lesser pelvis. So here is the sacrum, the two coxal bones. Here's the pelvic brim. The pelvic inlet is here. The lesser pelvis is back here. The greater pelvis is up in this vicinity, this area here. There's the femur, which articulates here in the pelvic bone to form the hip. Each coxal bone is 3 fused bones. I mentioned this the other day in class, that the ilium, the ischium, and the pubis, when you're born, when you're a toddler, when you're up into your teens, you still have 3 independent bones. You get to be my age, those bones are completely fused to form the coxal bones. They all come together to form a structure called the acetabulum, which is a deep socket on the lateral aspect of the coxal bone, which is where the head of the femur articulates to form the hip joint. The ilium and the pubis also contribute to the obturator foramen, which is the opening in each coxal bone through which nerves and blood vessels travel. There's the obturator foramen there. Again, the pelvic opening there, the pelvic inlet. Pelvic bones, here's the ilium. And this structure here, this little depressed area, is the iliac fossa. That's the pubis bone that comes together here in the front. The pubic arch, that is a big pubic symphysis, which is a large collection of cartilage. And then we have the ischium bone here, the sort of purple one. The ilium forms the superior portion of the coxal bone, has the iliac crest, the superior border of the ala, which is the flared superior wing of the ilium. The anterior superior iliac spine, or ASIS, is a bony projection at the anterior end of the iliac crest. Just inferior to the ASIS is a smaller ridge, the anterior inferior iliac spine. The posterior inferior iliac spine, or the PCIS, is the bony ridge at the superior or posterior end of the iliac crest, just inferior to the PSIS. Body of the ilium is inferior portion of the ilium. The greater sciatic notch is a deep groove inferior to the posterior inferior iliac spine, through which the sciatic nerve passes. The iliac fossa is the anterior portion of the medial surface of the ala. The arcuate line marks where the ilium forms part of the pelvic brim, which runs from roughened posterior articular surfaces along the brim of the body of the ilium. Smooth lateral surface of the ilium, the gluteal surface on the backside. Features following 3 lines. You have the posterior, anterior, and inferior gluteal lines, which are attachment sites for the gluteal muscles. The ischium is made up of the ischial body and the ramus. They form a somewhat C-shaped posterior-inferior portion of the coxal bone. Posterior ischial body forms part of the acetabulum. The ischial spine projects posteriorly and medially from the body to which the ligament from the sacrum is attached. The lesser sciatic notch is just inferior to the spine and provides a passageway for blood vessels and nerves. The anterior ischial ramus forms a portion of the obturator foramen. The ischial tuberosity is a prominent feature on the posterior aspect of the ischium. It bears all of the body's weight when you are sitting down properly. The pubis is the smallest of the coxal bones. The three parts that approximate the C shape has a superior pubic ramus, which contributes to the acetabulum. The pubic body and inferior pubic ramus form parts of the boundary of the obturator foramen. The pubic symphysis is a joint where the two pubic bones are separated by a fibrocartilaginous pad, and the pubic arch has an angle formed by the two pubic bodies that differs between the genders. One gender has a more round opening in the pubis than the other. Again, here are the three bones: the ilium, the ischium, the purple one, and the pubis. That structures the acetabulum. You can see where a portion of each bone plays a role in that. You can see the obturator foramen is made up of parts of the ilium, the ischium, and the pubis. There's the ala right there. The pelvis, like other skeletal features, differs between genders. The female pelvis, which is adapted for childbirth, is generally wider and shallower than its male equivalent. Again, this can be used to determine weight. The shape of the gender. The shape of the greater pelvis is wider in females with flared iliac crests, which increases the distance between the anterior superior iliac spines. The coccyx and sacrum of females is usually wider and shorter than the male, and the female coccyx is more movable and more posteriorly oriented than males. The pelvic inlet and outlet. Females' inlet is wider and oval shaped, whereas males are narrow and heart shaped. The female outlet is generally wider than males. The acetabulae are generally further apart in females and pointed more anteriorly than in males. And the pubic arch angle measured in females between 90 and 100 degrees, whereas males between 60 and 70. The ischial tuberosities tend to point laterally in females, while males point more medially. And the female pelvis is generally lighter and less robust than the male equivalent due to greater muscle mass and body weight of the average male. So again, here's your female opening with the sides pointing sort of pointing outward, and male with the more heart shape with these structures pointing more upward than that. Again, one of those things, bones used in the my TV show. She could take one of these and say that, yep, that's a female or that's a male. The femur is the largest and strongest bone in the body. It's the only bone in the thigh. Again, common parlance, we will call this thing that goes from your hip to your foot, your leg, but technically from hip to knee is the thigh. Proximal epiphysis features a prominent spherical head, which articulates with the acetabulum at the hip joint. Also has the fovea capitis, which is a small pit in the center of the head where a small ligament attaches to stabilize the joint. The femur has a neck just distal to the head, has the greater and lesser trochanters. Again, the only place the trochanter is found is in the femur. The linea aspera is a prominent line running down the posterior shaft, divides into two lines, and leads to the medial and lateral epicondyles near the distal diaphysis. The epicondyles taper down to medial and lateral condyles, which articulate with the tibia to form the knee joint. The intercondylar fossa is an indention between the condyles of the posterior distal epiphyses, which has a smooth anterior surface, which is called the patellar surface. The patella or kneecap articulates with patellar surface on the femur. It is what is called a sesamoid bone, which means it is located entirely within a tendon, in this case, the anterior thigh muscle. The patellar ligament is the distal continuation of this tendon, inserts in the tibia, which secures the bone over the anterior portion of the knee. And the proximal end of the patella is the base, and the distal end is the apex. So there's the kneecap with the base, and the apex sits on the knee right there. There's the medial epicondyle, the lateral epicondyle. You come up here. There's your greater trochanter. There's your lesser trochanter, the intertrochanteric crest, gluteal tuberosities, where the gluteus muscle is attached, linea aspera, and you see it's ridged, and then it starts to fork there and goes down to each one of the epicondyles. Just like the area from the hip to the knee is called the thigh, the area from the knee to the ankle is called the leg. Contains the tibia and the fibula, bones of the leg. They are connected by an interosseous membrane, similar to the radius and ulna. They articulate with one another at the proximal and distal tibiofibular joints. The tibia is larger and lies medially to the bone of the leg, or is the larger medial bone of the leg. It bears the weight of the body, has two concave depressions, the medial and lateral epicondyles at the proximal end of the tibia that articulates with the femoral condyles to form the knee joint. Condyles are separated by a ridge called the intercondylar eminence. The tibia also contains the tibial tuberosity, which is found distal to the condyles. It is a rough projection on the anterior surface where the patellar ligament attaches. The tibial diaphysis features the shin, or the anterior crest. Everybody knows when you bump your shin. Terminates at the medial malleolus, palpable lump of bone at the ankle. The flat end of the distal epiphyses is an articular surface which makes up the knee joint. The fibula is the smaller bone. It is the more lateral of the two bones. It bears only about 1/6 of the body weight. It does exhibit some features. It has a head, which articulates with the lateral tibia approximately at the proximal tibiofibular joint. The fibula expands into the palpable lateral malleolus, distal to the distal tibiofibular joint, and that lateral malleolus articulates with the lateral talus. That stabilizes the knee joint. In just a minute, we'll talk about the talus bone. So there, again, there's the tibia with its medial and medial malleolus. There's the lateral malleolus. That's formation of the ankle joint. There's the articular surface. There's the interosseous membrane running in between, the anterior crest, the tibia and fibula, medial epicondyle. There's the head of the fibula there, articulates just underneath the head of the tibia at the lateral condyle. Bones of the ankle and foot, again, tarsals, metacarpals, and phalanges. The structure of the ankle and foot is similar to the hand and wrist. Has the tarsal bones, which are the 7 short bones made up of the ankle region, connecting the leg to the foot. You have the proximal tarsals, which are the talus, the calcaneus, and the navicular. And then you have the distal tarsals from medial to lateral. You have the medial cuneiform, intermediate cuneiform, lateral cuneiform, and the cuboid. The tarsals has the dome-shaped talus. That is the only tarsal bone that articulates with the bones of the leg. The underside or plantar surface of the talus articulates with the dorsal side of the calcaneus or heel bone. The posterior surface of the calcaneus provides attachments for the calcaneal tendon, also known as the Achilles tendon. The distal head of the talus articulates with boat-shaped navicular bone. The metatarsals numbered 1 through 5 from medial to lateral. So again, just like in the hand. So it starts on the side of the big toe. They have a proximal base, a medial shaft, and a distal head. There are 14 phalanges in your toes. Toes 2 through 5 have proximal, middle, and distal phalanges. The great toe, or the hallux, has only proximal and distal. And again, here's the arrangement. There's the talus bone sitting on top of the calcaneus bone. And you have the navicular, cuboid, medial cuneiform, intermediate, lateral, cuboid. Metatarsals 1 through 5, phalanges 1 through 5. And like I said in lab the other day, or in class, there are, in your little toe, there are 3 bones. No matter how little your toe is, it's still got 3 bones in it. Standing looking at the side, again, here's the calcaneus bone. There's the talus bone, takes all the weight of the body, transfers it into this bone and these bones. There's a navicular, cuboid, and the 5th through the 1st metatarsal bones. Bones of the foot don't normally lie flat on the ground. They have an arch. You have 3 arches which support the ligaments, are supported by ligaments and muscles, help support and distribute the body's weight during movement. You have the medial longitudinal arch. It's the most prominent, runs along the medial side of the foot from calcaneus to metatarsals. You have the lateral longitudinal arch, which runs from the lateral calcaneus to metatarsals 4 and 5. And you have the transverse arch, which runs along the middle of the foot, involving the distal tarsals and all 5 metatarsals. So there are your arches. And that's what a foot should look like. Some people, like me, for instance, I have what are called flat feet. I have an arch, but it is not very prominent. You may have heard of people suffering from what are called fallen arches. That's when these ligaments become stretched. And while my feet sit fairly flat on the floor, when I'm barefooted, it's comfortable for me. That's because that's just the way my feet are made. But if you do have what are referred to as fallen arches, it can be quite painful. A couple of study boosts to try to remember some of these things. Stop letting the people touch the cadaver's hand. Helps you remember the carpal bones. Remember, that's the bones of the wrist. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Mentions hand, so remember, describes the carpals, not the tarsals. Hand. Remember, trapezium is by the thumb. Tibia and fibula. This college needs me, or excuse me, tibia is thick, inner bone, T-I, thick, inner bone. Fibula, lateral bone, L-A for lateral. This college needs me in lab classes. That's the names of the tarsals from proximal to distal and medial to lateral. You've got talus, calcaneus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, cuboid. Some visual analogies. If you turn the ulna on its side, the trochlear notch is the shape of the letter U. To remember on which side we find the radius, make a thumbs up gesture. Think of the word radical. This will remind you that the radius is on the same side as the thumb making gesture. Take the radial pulse. The radius is on the same side as the radial pulse. You take your radial pulse right here. So that's the radius over there. Patella in Latin means little plate. So the patella is a bone somewhat shaped like a little plate. Navicular bone by shape. It resembles a boat. So think of the word navy to connect navicular and boat. And that wraps up the chapter on the skeleton. On Friday, we will start the chapter on joints, and I will get your second exam and second essay questions loaded up into Blackboard, so you can start thinking about that this weekend. Have a great weekend. See you Friday.